Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wold, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guest Mark Griffin, President and CEO of Lewis Drug. Mark, great to see you as always.
Good morning, Jeff. Likewise.
You've had some big news recently. Lewis, which has been a family-owned company for decades, serving South Dakota and other Midwestern states, is going to merge with Sanford Health. Maybe just as backdrop before we get into the merger and what it means, you could just give us a brief capsule history of Lewis.
Lewis Drug is based in Sioux Falls, South Dakota, and we operate in South Dakota, Minnesota, and Iowa. We have 61 stores, and we've had our best 5 years in history, and that history is 82 years, and my father was one of the founders that long ago. So things are going very well. We're excited about the quote merger, and so is Sanford. They have been interested in us for over a decade totally, and we've been operating for 25 years as partners in our rural stores, which there's over 40, and it's gone extremely well.
And Mark, what made you feel that this was the right moment to sell? I mean, at a moment when so many regional drug chains and even national drug chains are struggling, you guys, as you said, are doing very well. Why was this the right time to make the deal with Sanford?
Well, as you know, timing is everything. And I think because of our recent past record, which, like I said, has been the best 5 years we've had in 82 years recently, the opportunity was there. And when you have a willing partner like Sanford, and, you know, we've had other opportunities from a large number of different companies approach us, but I think this is the best scenario, the best fit, and I think Sanford believes that too.
How will the communities that you serve, you and Sanford serve, benefit from the combination of the two companies?
The rural stores in particular go out probably a 300-mile radius. Those stores, more traditional size, can include some of Sanford's, whether it's DME or whether you know, you name it. Could be audio, could be eyeglass. There's a number of areas they could get involved in, and not to mention anything regarding direct patient interaction with doctors, with our pharmacists, which is another nice feature. And that's important because when the stores are spread out 25 miles or 30 miles, it makes a big difference.
And Lewis will continue to operate under its own banner, am I correct? The Lewis Drug name?
Our brand is pretty well known around here, and Sanford has said that they're basically going to leave everything as is and won't touch the brand for a minimum of 10 years, if not longer. They're actually asked me to stay on a couple of years. I have a new title, and I'm now the CEO emeritus. So, but I don't have a boss, which is a good feature. So, all things considered, it's a good deal. Yeah, but it's an extension of a partnership that's been rife with success over the last 25 years.
Tell us a little bit about it. You said they've located clinics in or near a lot of your stores. Is that correct?
We have 9 full-blown clinics on our properties, and we own some of the properties, the real estate that they have built their clinics on, and they're connected to our pharmacies. And it's been a great asset for the consumer because he could just, or she can go to the clinic and then walk a few steps and you're in the pharmacy and take care of everything at once.
In those facilities where your pharmacies are right adjacent to the clinics, have you seen more interaction between the physician and the pharmacist than perhaps you did previously?
They do, to the point where they become friends and good friends in some cases. And I think, as everybody knows in the pharmacy business, trust is paramount. And I think this builds trust, and it's worked out very well.
And will Lewis benefit, or I guess I could ask if Sanford will benefit from sharing technology and certain procedures and procedures along those lines?
Well, I think we're proud of, number one, our team at Lewis, but we're also proud of our technology and efficiencies that we can share with Sanford that perhaps they haven't developed yet. And we've already been discussing that, and we've already integrated some of those things.
And Mark, we talked a lot about healthcare. What will become of Lewis's retail business? As I think all our viewers know, you have quite a large assortment of products, much larger than most drugstores, which is I think one of the keys to your success. Is that going to remain in the case? I mean, you have the garden centers, things like that. I mean,
Oh, yeah.
they will
Well,
remain.
that's all part of our success, and they like our success, and once again, I pledge not to mess with success.
Mark, a final question for you. You've been a fixture, a leader in this industry for a long, long time. Will you maintain your work at NACDS and other industry groups that has been a big part of what you've done over the past couple of decades?
Well, Jeff, they have actually asked me to stay involved in ACDS, and I signed up for another couple of years on the board, and proud to say I'm the longest serving board member, and I'm going to enjoy the interaction and still be involved.
Okay, well, the industry will be better for that. Congratulations on
Thank
the
you.
deal, Mark, and I'm sure Lewis will thrive in the new situation with Sanford. Thanks so
Thanks
much.
for your time, Jeff. Appreciate it.